also very important to strengthen the healthcare system that reaches the benchmark of developed nations. We enhance the opportunities for medical education. And we have done very well in this regard. Next one, please. The medical college number has increased, has become double, 102% increase. We moved from 387 medical colleges 10 years ago to 780. And we now have more government medical colleges than private medical colleges, and that enhances the affordability for the students. Expansion of the AMS system is underlined by the fact that 22 new AMSs have been sanctioned and 18 of them are operational. Next one, please. We would also like to emphasize here that a phenomenal increase in the existing number of undergraduate and postgraduate seats are undertaken. These seats have seen 130% and 135% enhancement, respectively, since 2013-14. 52,000 seats, UG seats, are now in 2013-14 are now 118,000 seats. And in terms of PG seats, 52,000 seats are now have been escalated to close to 75,000 seats, giving opportunities for training. Next one, please. Two important schemes, one for the undergraduate program and one for the PG program, have played an important role in this area. Next one, please. A very special scheme has been to upgrade our district and referral hospitals into medical colleges. Very happy to state here that 157 medical colleges under this scheme have been approved, and 131 of them are already functional. And to get the best out of this resource, the government is working on co-locating nursing colleges in each one of these 157 medical colleges. There is a lovely Zora Medical College, Mizoram, which I had the opportunity to visit just about a week ago. Beautiful facilities are coming up. A vibrant ecosystem in medical education is building up. Next. We are working on regulatory reforms at a feverish pitch. The big reform has been the institution of the National Medical Commission that replaced the erstwhile Medical Council of India. But taking the opportunity of the new act, we have rationalized minimum standard requirements to make them more liberal without compromising quality. We have introduced a new curriculum. Teachers' eligibility qualifications have been improved. A national medical registry is being launched. New diploma courses through the pathway of National Board of Examinations at district hospitals has been instituted. A lot more is happening, and we expect the pace of reform will continue into future. Next one. District residency program is a special program which links the public health system with the medical education system. All postgraduate students, all postgraduate residents belonging to any specialty in the second year of their training out of the 3 years are now being posted for a period of 3 months at district level hospitals. What does it give? A real life experience for learning and practical skills embracement. But equally importantly, this enhances the strength, the capability of the district health system, the district hospitals. These students, which are already, they have a 1-year experience in the specialty, work as team with a specialist in the district hospitals and improve the care. And it also brings in continuum of care. This is a unique program which is bringing an interface between the public health system and medical education. Next. E-learning resources are being used increasingly in medical education and pushing the frontier further. Next one. We are now also using the power of AI for medical education and research through initiatives as COE in AI in healthcare at three of our prime institutions, as also using AI-driven simulation skill labs. Next one. Very briefly, I'd now like to highlight the components of the daycare centers, daycare cancer center announcement that the Honorable Finance Minister made. There is a rising burden of cancer in the country. 1.46 million new cancer cases are registered, are noticed every year. Sadly, a lot of them are diagnosed late, and this has to change. Next one. Already, the country, the nation, is laying emphasis on screening and early detection. A nationwide screening on 3 important cancers is undertaken. Under this, 26 crore screening, 26 crore people have been screened for oral cancer, 14 crore for breast cancer, and 9 crore for cancer cervix. We have established state cancer institutes, 19 of them. Tertiary cancer care centers have been established, 20 of them, and then there's an Apex National Cancer Institute at AIIMS Delhi. Daycare cancer centers have already been established in 372 districts, and we will now pitch at improving them further. Likewise, district and CSC NCD clinics are running, and huge efforts on capacity development and awareness generation are being instituted. Next. In order to provide financial coverage for cancer care, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana has multiple care packages. There is also the Health Minister's Cancer Patient Fund. And of course, access to cancer medicines at affordable cost is being also instituted through the Jan Aushadhi Kendra system, through Amrit pharmacies, as well as through the pathway of reduced customs duty and GST reductions for selected cancer drugs. In the announcement that has been made, the government will facilitate setting up of daycare cancer centers in all the districts in the next 3 years. And importantly, 200 of these shall be established in this financial year. So we will establish 200 new centers. We will build and strengthen the 372 that already exist and systematically achieve the saturation level of 1 DCC per district within the next 3 years. Next one, please. What would this center entail? This will be a 4 to 6 bedded unit for chemotherapy, for follow-up care, for supportive care, and for counseling. 2, there will be provision for additional equipment, medicines, disposables, and training will be instituted to the teams in the district hospitals. Treatment plans will be instituted by the tertiary care system, the state cancer institutes, and the INIs. Same-day treatment model will be followed to save on stress and financial burden. Linkages with Ayushman Arogya Mandir, that is the primary healthcare system, as well as the tertiary system, the state cancer institutes will be established. And we shall optimally use telemedicine and teleoncology to create these connections. Thank you very much. These are very aspirational and game-changing budget announcements and programs. We all will make a success of this and create a healthcare system of India that befits the standards of developed nations before 2047, the 100th anniversary of India's independence. Thank you very much.
Thank you, Dr. V.K. Paul. अब मैं प्रोफेसर अमिता भिडे को मिनिस्ट्री ऑफ हाउसिंग एंड अर्बन अफेयर्स की ओर से विचार रखने के लिए आमंत्रित करता हूं. Professor Bhide is a professor at the Center for Urban Policy and Governance in the School of Habitat Studies, Tata Institute of Social Sciences, Mumbai. Over to you, Professor Bhide.
Thank you. Thank you. Just to check, am I visible, audible?
Yes.
Am I audible? Yes, thank you so much. So at the first and at the outset, let me really thank all of you for organizing this webinar and all the panelists, extremely esteemed panelists who are part of the webinar as well, beginning with Professor Jatish Kumar, the secretaries of the various departments, Professor Gupta and Professor V.K. Paul, and so on and so forth. Okay. I think when we think about urbanization itself and the role of Mahua is located right at the forefront of facing a huge opportunity as well as a challenge. The opportunity called urbanization, which is now an emergent reality, a huge transformation from when we became independent. We were really called rural India. We were predominantly rural, and now we are at a stage where we are transitioning to urban India. This gives us multiple opportunities, economic opportunities, uh, and also to ensure that and determine for the world what is sustainable urbanization. Okay. But it also presents a lot of challenges in the form of a significant amount of people, more than 80% or so, who are working in the informal sector. And the informal sector is one which is surrounded with extremely risky and hazardous working and living conditions. It also has a high proportion of social vulnerabilities, and Mahua has this inevitable and extremely challenging task of matching this along with the physical infrastructure needs, the sustainability needs, and the governance needs of providing for the enhanced urbanization. It tries to do so through a variety of flagship missions, and I think we have made extremely significant progress there in the form of, if we look at the range of flagship missions, the first is Swachh Bharat mission, I think, which all of us are aware of, the Amrut, which looks at basically the water supply and the sanitation infrastructure,
Professor
which
Vijay,
also
Professor
becomes.
Vijay, if I may, Professor Vijay, but just one second. Are you showing some PowerPoint presentation? Because
No,
there
I'm
is
not
nothing
showing a
coming.
PowerPoint presentation.
Okay.
I'm
The
not showing a
control room
PowerPoint
would see.
presentation.
Oh, thank you. Then control room, if you please see why we are getting this black screen. Sure. NIC control room. Yeah, please go ahead, Professor Vijay.
Yeah. Then the cities, there is the National Urban Digital Mission, and there is cities program. And along with all of that, there are two things which I'm going to focus on in this talk, is basically the uh, uh, Deen Dayal Upadhyay Antyodaya Yojana, or the National Urban Livelihood Mission, and which works also in conjunction with PM Swanidhi, which is a program which was started in the context of street vending. Okay. So it's an approach, I think, right from the beginning. So the DAY NULM was instituted in 2014, and basically it is completely aligned with the overall mission and the theme of investing in people. It may sound surprising because when we think about urban development, we think of physical infrastructure building, very engineering and planned approach, but these are two flagship missions which really focus on investing in people, creating employment opportunities, creating services for them, and overall expanding the entire rubric of urban development and making it financially, socially much more inclusive and sustainable. Uh, you have first statement, I would say, of investing in people has basically been from 2014 until now. There is an entire transformative ecology of institutions which has happened. So there are national centers of excellence, there are national resource organizations, there is a dedicated center for sustainable livelihoods, which has now been instituted at the National Institute of Urban Affairs. And all this creates people and a cadre of people, more than 24,000 of them, who are committed to the cause of creating sustainable livelihoods, basically in the context of the uh, uh, national urbanization and urban development. The second thing that one would like to talk about really is that the entire approach of the NULM and the PM Swanidhi has been a learning approach, learning and iterate. You pilot things, you experiment with them, then you create models out of them, and then you upscale them at a state level and also at a national level, and always therefore create room for experimentation. I think this is something which is fantastic. And the kind of mandate that therefore the NULM carries is also very vast. On one hand, it is creating livelihoods. And in the last 8 to 10 years or so, from 2014 till now, there are more than 1,995 shelters built for homeless. There are more than 38 lakh people for whom livelihoods have been created. And there are more than 90 lakh women who've actually been covered under the entire rubric of institutions like self-help groups, and through which then enterprise development has happened. It is also very interesting to see that in PM Swanidhi, a program which was started in the context of a post-COVID crisis, really, uh, and that program also has been able to be extremely successful, with more than 68 lakh vendors all over the country, street vendors who are otherwise, I mean, they are micro business persons, one can call them, or nano business persons for that matter. And they have been set up on the overall path of financial inclusion, to the extent where not only have been these 68 lakh street vendors have been given loans, but they have also been connected through convergence with many other ministries of the government of India. There is an entire bouquet of aid schemes, which include social security schemes, which include a mapping of the entire household to see which other schemes can the household be eligible for, and then trying to ensure that the household gets benefit of all of those government of India schemes as well. And this is all done through a digital architecture, which also enables a extremely good monitoring and evaluation system. And I think this is something which is a huge, huge achievement, because till now and prior to 2014, most money which went into urban poverty alleviation programs was considered by banks, by relevant institutions, as money which is going down the drain. And in that sense, this has really been a transformative journey. Now, in the coming budget and in the coming years, this approach is being shifted even more. So, in consultation with a whole lot of collaborators, which include academic institutions, NGOs who are working on the ground, these resource organizations which have been created, consultants who have also started working